You know, your blood is way more than just the stuff that keeps you alive. It's like a microscopic crime scene, absolutely packed with clues about what's going on inside your body. So today, we're going to put on our detective hats and solve two totally different mysteries that are hidden deep within the bloodstream.
Seriously, every single drop of your blood tells a story. It's a complex narrative about your genetics, your health, and all the silent battles being fought inside you, right now. It's a story written in the language of cells and proteins.
The real challenge, though, is knowing how to read that story. So let's do it together. We're going to follow the evidence, connect the dots, and crack two real-life medical cases. You ready? Let's dive in.
Okay, our first case file is open. We're looking at a 16-year-old kid. On the surface, he just feels tired. But the real mystery, it's in the very structure of his red blood cells. Something is making them dangerously fragile.
So here are the first clues we have to work with. He's a teenager, he's always tired, sometimes his skin and eyes look a little yellow, that's the jaundice, and he's noticed some, well, dark urine. But this last clue, this is a big one. His mother had her spleen removed. That is a major piece of the puzzle.
And the plot thickens. During the physical exam, the doctor can actually feel his spleen, and it's enlarged. Now, you gotta think of the spleen as the body's quality control filter for blood. If it's swollen and overworked like this, it's a huge sign that it's just destroying something, and odds are it's its red blood cells.
Okay, the lab results are in, and now we've got hard data. His hemoglobin is low. No surprise there, that's the anemia making him tired. But look at this reticulocyte count. It's through the roof. That means his bone marrow is working overtime, just desperately trying to pump out new red blood cells. The high bilirubin, that confirms the old cells are being destroyed like crazy. And that negative Coombs test just tells us his own immune system isn't the attacker here. And here it is, the smoking gun. Under a microscope, his red blood cells, they don't look right. They aren't the normal, flexible little discs. They're these small, dense spheres called spherocytes. These things are fragile, they're misshapen, and they're exactly the kind of cell that an overzealous spleen would see and say, "Nope, you're out of here."
So, let's just recap the evidence. We've got an enlarged spleen working overtime, labs that scream red blood cell destruction, a picture of these weirdly shaped cells, and a really strong family connection. So, what's the final verdict, detective?
The diagnosis? Hereditary spherocytosis. It's a genetic condition where the proteins that are supposed to give a red blood cell its nice, flexible skeleton, they're defective. This defect forces the cell into that fragile little ball shape, which the spleen then recognizes as a problem and just eliminates. All the clues click right into place.
Okay, case one solved. Let's close that file and open up our second one. This is a totally different kind of mystery. We've got a young woman, and her problem isn't that her cells are being destroyed too fast. It's that her blood, it doesn't know when to stop flowing.
Our patient is a 22-year-old woman. And the clues here all point to a very clear pattern of what doctors call mucocutaneous bleeding. Basically bleeding from surfaces. Think really heavy periods, lots of nosebleeds, bruising super easily, and getting a small cut that just bleeds forever. And what do we see again? A family connection. An uncle on her mom's side has a similar issue.
Now, these lab results are fascinating. Her platelet count is totally normal, so she has all the basic building blocks for a clot. But her APTT, a test that measures how long it takes to clot, it's a little slow. And here's why. Look at the levels of these two key proteins, von Willebrand factor, or VWF, and factor VIII. They are critically low. You can think of these as the biological superglue that makes platelets stick together.
This chart just makes it crystal clear, doesn't it? Look at her von Willebrand factor level. It's down at 28%. The absolute minimum for the normal range is 50%. She has barely half the amount of that essential clotting glue that she needs to function.
So here's the central puzzle of this case, right? She has plenty of platelets, all the bricks she needs to build a clot. But the bleeding just won't stop. What's the missing piece of the puzzle? What's stopping those bricks from actually sticking together and sealing the deal? The diagnosis is type 1 von Willebrand disease, and it turns out it's the most common inherited bleeding disorder there is. It's all caused by not having enough of that VWF protein, that molecular glue. Without enough glue, the platelets just can't grab onto the injury site. They can't stick to each other, and the clot fails. Case closed.
So we've solved the mysteries. Pretty cool, right? But now let's talk about the solutions, because once you understand the exact cause of a problem, you can find a really precise and effective treatment.
For our first case, the hereditary spherocytosis, the best treatment is a splenectomy, literally removing the spleen. And it makes perfect sense, right? If the spleen is the factory that's systematically destroying these fragile cells, well, you remove the factory. A blood transfusion is just a temporary fix, a band-aid. A splenectomy solves the root problem.
Now, for our second case, the fix isn't surgical, it's chemical. The first-line drug is called desmopressin, or DDAVP. What it does is kind of brilliant. It sends a signal to the cells that line the blood vessels and basically tells them, hey, release your emergency stores of VWF and factor VIII. This gives the blood a temporary boost of exactly what it needs to form a solid clot.
So yeah, DDAVP is the first choice because it's so clever. It just uses the patient's own reserves. Now, for more severe cases, or if for some reason DDAVP doesn't work, doctors can go straight to the source and just infuse a concentrate of the missing proteins. But the goal is always to use the simplest, most elegant tool for the job.
Okay, so let's zoom out. What's the big picture here? These two cases, they seem completely different on the surface, but they teach us this incredibly important lesson about modern medicine and, well, about decoding our own biology.
The whole point is this: we can't really fix what we don't understand. The entire process we just went through, from symptoms to lab tests to diagnosis, it's all about finding the exact, precise point where the biological machine broke down.
And this is really the key takeaway. In case 1, we had a structural problem, a cell with the wrong shape. So the solution was physical, remove the organ that was destroying them. In case 2, we had a functional problem, a missing protein. So the solution was chemical, boost the levels of that protein. The treatment fits the problem perfectly.
And that is the incredible power of precision medicine. By learning to read these stories hidden in our own blood, we can stop just treating symptoms and start fixing the real, fundamental causes. And it just leaves you wondering, as our tools for decoding our own biology get even better, what incredible, complex mystery are we going to solve next?